Welcome to the Case-Based Discussion Assessment Training Module for Moody Health Center at Texas Chiropractic College. I'm Dr. Corey Milon, the Director of Clinical Education, and I'll be leading your module today. Today's module will cover what a case-based discussion is, the questions you'll be grading, and an example of the case-based discussion on the assessment portal. A case-based discussion is one of the longest assessments you'll have to do as an attending clinician. But in almost all the clinical courses, only one case-based discussion per student is required per trimester. So it's very important that you understand the case-based discussion and grade it appropriately, as there are not many options for students to have a second or third case-based discussion to average with their prior scores. So let's go over what the benefits of a case-based discussion are. Case-based discussions are a discussion between the attending and the student about the entire case, from documentation all the way to management of care and supporting literature. It helps to improve clinical decision-making, clinical knowledge, and patient management. It also improves clinical record keeping, and it gives students an opportunity to reflect on and discuss their approach to the patient and identify strategies to improve their practice. It also lets us as attendings share our professional knowledge and experience in a collegial way. It also enables students to access experts in clinical decision making and understand the rationale for preferred management choices. It's a guided learning through a structured feedback system that helps identify areas for development as part of a continuum of learning. It also assists students in identifying strategies to improve their own practice. If you're going to sit down and do a case-based discussion with a student, you'll access the assessment portal just like every other assessment. You'll fill out the assessment intro page and select case-based discussion. There are 7 data collection points or questions that you'll be assessing, followed by 4 PICO questions. We'll discuss both of those later. You will then type in a self-directed learning assignment, which is typically supporting literature for what was discussed between you and the intern. There's then a section for discussion with the faculty, which allows you to click the covered components of the case-based discussion. Remember that the 7 scored components and the 4 PICO components are average for the students to see later to see if they were below, at, or above benchmark for their clinic. Remember to give feedback. Verbal feedback is important, and you need to document the verbal feedback on the feedback page. Here's the case-based discussion handout. As you'll notice, these questions are very short. This is a rubric used amongst all medical fields. On the right-hand side, you'll see the description of the metacompetencies that are covered for each question. Here's an overview of the question. The first question assesses their record keeping and their documentation skills. The second, you'll be grading their clinical assessment or evaluation skills. Third, you'll be grading their comprehensive treatment and their understanding of that treatment. Fourth is their investigation and clinical mindfulness. Did they ask the right questions and did they follow the right train of thought? Fifth is the follow-up or the post-encounter. After they encountered the patient and gathered information, did they follow up with research or questions to help better their care? Next is clinical reasoning. Did they use the right rationale throughout the entire case? Lastly is the overall clinical care. You're going to grade the complete case care and how they managed the patient. Next is PICO. PICO again is Patient Intervention, Comparison, and Outcome. It's a search tool that helps to facilitate good literature. This is a screenshot of the PICO rubric and as it applies to the Dreyfus model: novice, advanced, beginner, competent, and proficient. Please pause the video if you need to review the PICO format and questions as related to the Dreyfus model. Once you've completed the 7 questions and the 4 PICO questions, you'll move to the feedback page, which you'll select case-based discussion, then do a short description of your feedback, what went well, and some things to work on. If clinical education review is required, please type it in at this point and the specifics of the assignment. Lastly, type in your 4-letter code that only you and the clinic data manager know. Let's see what this looks like. We'll start a new assessment. Choose the examiner or yourself and the intern that you're evaluating. Pick the clinic that they are in, and then type the patient's chart number. Select the case type, alumni, case study, outpatient, outreach, staff, student, and other. Choose the assessment. We're doing a case-based discussion. This is a description of what a case-based discussion is. Now you're going to evaluate the following statements. How was the student's record keeping? Graded on the Dreyfus model. How was their overall clinical assessment? Their comprehensive treatment? Investigation and clinical mindfulness? The follow-up? Their clinical reasoning? And the overall clinical care. This would be a self-directed learning assignment. As in our SNAPS assignment, let's say it was a rotator cuff injury and the student wanted to do more research on rehab techniques. So, now you're going to select what was discussed with the faculty. Did they give you a general case review? Yes. Did you discuss lessons learned from the patient encounter? Did you talk about clinical reasoning and their thought process? Did you discuss the comprehensiveness of care? Did the student consider any ancillary exams, such as x-rays, lab work needed, or reports from other physicians? This was other treatment options. Did you discuss if co-management required or if there's other things that we could alter in the care to improve the patient outcome? Did you discuss the best practice and guidelines for that specific condition? Anything other you discuss, please click Other and do a short description. Next is PICO. PICO is, did the student ask a clinical question using PICO? Did they find relevant literature? Did the student summarize the evidence? And the student apply the evidence to the case? This is a link for PICO if students are having a hard time finding relevant literature. Then you'll click Finish the Assessment and Next. This will bring you to the feedback page. Click Case-Based Discussion. You'll document what went well, and then let's say the student was slow to alter treatment when results were not seen. If clinical education review is required, you would place it here and describe the assignment, and then type in your verification code. Case-based discussion is done. This concludes your case-based discussion training module. If you have any questions, please refer to your handout, the syllabi, or the clinic handbook. For answers that can't be found there, please refer to the following. For clinical operations, ask the Director of Clinical Services. For education concerns, you can ask me, the Director of Clinical Education, and for resources, please ask the Clinic Data Manager. Thank you for your attention.